This video is about understanding and diagnosing the condition of our reproductive fluids, both male and female, according to Ayurveda. The reproductive fluid in Ayurveda is called Shukra, which means both the sperm and the ovum. Basically means reproductive fluids in general. Shukra specifically means the male sperm, and Atharva means or indicates the female ovum, but often they're both referred to as Shukra Dhatu, the reproductive tissue. Now, when this tissue is balanced, we feel strength, we have good stamina, we have good immunity, we have good endurance, and we have a healthy libido without excessive desire for sex. Now, if the reproductive fluids are depleted for the man, we see an absence of sperm, low sperm count, low libido, kind of cold testicles, premature ejaculation, and even low immunity. And of course, this is caused by excess sex, excess masturbation, excess exercise, hot and spicy foods, lack of fat in the diet, dehydration, even poor digestion. And for a woman, when there's depletion or vata in the reproductive fluid, she has infrequent menstruation, delayed menstruation, painful menstruation, and even premature orgasm, and fear and anxiety related to sex, and even painful intercourse. And it's often caused by the same conditions as the man: dissatisfied with sexual life, excess inability to reach orgasm, caused initially by overindulgence in sex, overindulgence in masturbation, or high vata aggravation, where a lot of stress, a lot of anxiety, excessive travel, dehydration, depleting vata aggravating diet, all can create this depletion of the sexual fluids or reproductive fluids for a man and woman. And that's vata. When there's pitta in the reproductive fluids, for a man, this is inflammation in the prostate, also a type of premature ejaculation and overexcitement, a depletion of your immunity as well, because it's burned by the pitta, tender or warm testicles, and even at some stages blood in the semen. Mostly we think of prostate inflammation when we think of pitta in the male reproductive system. For the woman, we will see when there's pitta in her shukra or ovum, we have heavy bleeding, and endometriosis is considered pitta in the shukra, in the atharva, the woman's reproductive system or the ovum. There'll also be irritability, sensitive nipples, tenderness in the breast, and of course heavy bleeding in the early stages. And so it's like an inflammatory condition of the reproductive fluids. For the man, inflammation in the prostate; for the woman, endometriosis, when there's pitta involved in the reproductive fluids. And when there's a kapha, the reproductive fluids are increased. This is coming from lack of exercise, too much meat, too much dairy products, heavy foods, too much water, and even steroids. And then we're getting an increased desire for sex, even a preoccupation with sex, excess production of semen with low sperm count, and dreams even of sex. But more importantly, we can contribute to enlarged prostate, and the testicles tend to be cold and cool. And for women, when there's excess kapha or excess reproductive fluid, she has a kind of a shortened menstruation cycle and prolonged slow cycle, or less cycles in the year, and also swellingness, particularly in the breast, edema, swelling, and cystic ovaries and fibroid tumors are very typical when there's a kapha-dominated woman with high kapha, and there's kapha then goes in the reproductive fluid, and then we are concerned about fibroids and tumors. So we definitely don't want to increase our reproductive fluid as much as we don't want to decrease it. So it's important to understand the state of your reproductive fluid and ultimately your reproductive system, but we're talking about the fluid itself. And so if we look at it from the point of view of Vata Pitta Kapha, we can see that if there's too much Vata or depletion, then there's a lack of libido and premature ejaculation or orgasm. And if there's Pitta in the reproductive fluid, there actually can be a more desire for sex, but can contribute to inflammation in the prostate or endometriosis for the woman and excessive bleeding. And for excess reproductive fluid, as in kapha, then we have an excess desire for sex and enlarged prostate. And for the woman, we have this delayed menstruation, swelling, and even the risk of cystic ovaries and fibroid tumors. So it's important to look at your reproductive fluid and system from this point of view and make sure that it's balanced. And of course, this video isn't about treatment, but first understanding and diagnosing the state of your Shukra Dhatu, which is your reproductive fluid, according to Ayurveda. Thank you very much.